Pros and cons of buttock implant versus fat transfer. Implant, there you go. Pros, you can get the good projection of whatever size you want. But what are the cons? If you do have the hip dip, it's actually going to make it worse because it basically brings out your buttock and it shows the dip even more. Number two, when you're sitting on this, as much as we put it intramuscular, which means between the muscle, it sometimes has a tendency to move and it does get hard. But it does give you a nice shape if you're just trying to bring the buttock out. But again, it can get hard, and if you don't have a big hip dip, it can exaggerate it. Syringe, there you go. Fat transfer, pretend this is actually fat. There's no fat in here, but if pretended fat, we can actually contour it to your body. What are the cons? Well, if you go into the muscle by going to a place they don't do a lot of these, then they could have some complication with the fat transfer. But if you actually go to the right place, which they do a lot of these, it actually can come out pretty nice and survival of the fat is pretty high.